My name is Carmen. I'm a level 2 nursing student at McMaster University, and today I'm going to be demonstrating a subcutaneous and intramuscular injection. So the first thing we're going to do is look at the MARS, and we're going to think about all the safety considerations. So the first thing that we're looking at is that our patient is allergic to codeine, so we have to make sure we don't administer that to her. And we're also going to keep in mind about the 8 rights. So the 8 rights is patient, medication, dose, time, route, frequency, site, and the reason. And we're also going to complete our hand hygiene because we are doing an invasive procedure, and we want to make sure that our patient doesn't get an infection. So the first thing we're going to do is assess our patient's build, weight, and body size. And since Mr. Mancini falls within the normal ranges, we're going to use the normal ranges for our needles and syringes as well. So for our subcutaneous, we're going to be using a 25 gauge. And then for intramuscular, we're going to be using a 22 gauge. And if our patient was obese and overweight, we would be using a longer needle size. The next step now is we're going to look back at the MARS. And so for our medication order for heparin is 5,000 units. And according to my calculations, that's 1 milliliter. So that's why I'm going to be using the 1 milliliter syringe for that. And the second medication order, which is the Halidol for 1 milligram. And for that, the calculations is 0.5 milliliters. So I'll also be using the 1 milliliter syringe for that. Alright, just to take note, so for subcutaneous injections, the needle gauge ranges from 25 to 27, and the syringe would be 1 to 3 milliliters. And then for our intramuscular, it would range from 18 to 27, depending on like how viscous the medication is, and it would also be within the ranges of 1 to 3 milliliters for the syringe. Alright, so we're going to make sure we complete our hand hygiene just because we are doing an invasive technique and we want to decrease the risk of infection. So what we're going to do, we are going to take the 1 milliliter needle, and we're going to put the blunt filter needle onto it. And we're going to make sure we check the ampule and make sure that the medication is what we're injecting, so the heparin, and we're going to make sure that it's not expired. And we're going to use a cotton swab when breaking off the ampule just to make sure we're safe during this procedure. Alright, now what we're going to do, we're going to flick the syringe just to make sure we get any of the air bubbles out, and we're going to dispose the excess into the sink. Alright, now that this is prepared properly, we're going to take the filter needle off. Actually, sorry, before I take the filter needle off, we're going to use the one-hand technique and put the cap back on. And then this is when we're going to replace the filter needle with the 25 gauge needle that we're going to be using for the injection. Now that we have this ready, we're going to label this. So we're going to write down that it is heparin, that the dose or that the syringe has 1 milliliter, and the patient's name. I'm going to set that aside. Okay, so now we're going to prepare our Halidol dose, and we're going to be using the 1 milliliter syringe again. And we're going to check the medication to make sure it's not expired and to make sure that it is the right medication, in fact. And we're just going to pop off the lid. And then we're going to apply our blunt filter needle onto our syringe. We're going to make sure we wipe down the vial. Okay, and then we're going to take the cap off. And we're going to be taking 0.5 milliliter out. And same thing with before, we're going to tap it to make sure we get all the air bubbles out. Dispose the excess in the sink. cap it back on with the one hand technique. And we're going to be putting the 22 gauge needle onto our Halidol syringe. And we're going to make sure we label it with our patient, with the dose, and with how much we put in. And then we would also relabel this vial if it is a multi-use dose. So we would write down the amount left, what it is, and the date that it was open. And now we would dispose of the filter needle in the sharps container, and everything else, or actually the ampule would also go into the sharps container as well, and then we would put everything else into the garbage. Alright, so we're gonna use our hand hygiene, so we're gonna make sure we sanitize our hands, and then we're going to put on our gloves. And while we're putting on our gloves, I'm just double checking the Mars again to make sure we have the right dose and right type of drug. So we're gonna bring these to our patient's bedside, and we're gonna make sure we grab an alcohol swab as well. So what we're gonna do now, we're just gonna want to introduce ourselves to the patient. So hi, Mr. Mancini. Today we're going to be completing a subcutaneous and intramuscular injection. You might feel a bit of discomfort, a slight tingling sensation, but it is nothing to be too concerned about. And we're gonna make sure that we palpate to make sure that there aren't any like lumps, any issues with tenderness, and just to make sure that the site is appropriate for our injection. And we're going to also make sure that Mr. Mancini is our correct patient, so we're going to check his patient identification by looking at his wristband. So we're going to use an alcohol swab to clean the area that we're going to be performing the injection site. And we're going to take this off, and we're going to make sure we have it pinched, and we're going to be inserting the needle at a 45 degree to 90 degree angle, and we're going to make sure we stabilize and then slowly inject. Okay, and now we're just going to put on a cotton swab and just apply pressure onto the area. While this is done, we're just going to put this lid back up in order to protect ourselves from poking the needle. To note, the three areas that you can perform a subcutaneous injection are the posterior aspect of the upper arm, the abdominal area below the costal margins and above the iliac crest, and also the anterior aspect of the thighs. So the three sites that you can use for the IM injection is the deltoid muscle, the vastus lateralis, and the ventrogluteal muscle. So what we're gonna do before we have our injection is we're gonna clean off the area with a alcohol swab, and we're gonna make sure we get 5 centimeters of radius for it. And after that's done, we're gonna check against the Mars just to make sure that we have the correct medication, which we do. And so now that's done, we're gonna take off the cap and we're gonna make sure we landmark. So it's gonna be 3 fingers down from the acromion process. And now that we have it ready, before we do the injection, we're gonna make sure to palpate and make sure that there are no lumps, masses, lesions, or anything of the sort. And now that it's fine, we're going to go back to our landmarking, 3 fingers down from the acromion process, and we're just gonna stretch out the skin, and we're gonna inject from 90 degrees. And we're gonna stabilize, inject, we're gonna remove it, and then we're just gonna apply a cotton swab to stop the bleeding. So now I'm gonna put the cap back on using the one hand technique. We're gonna dispose of the needle into the sharps container, And then now what we're gonna do, we're gonna monitor the site to make sure that we don't have any bruising, swelling, and any other reactions that the patient might have. And after we've done that, we're gonna make sure we document the medication, the site that it was injected, and the patient that we completed it on. Put the gloves just into the regular garbage receptacle and make sure we complete our hand hygiene again.